Hi, this is Legacy, and this video is about jaundice in newborns. So, in this video, we're actually going to go over a few things. First of all, what is jaundice? Does my baby have jaundice? What are the side effects? And how do you cure jaundice? So, first, let's go into the main thing. What is jaundice? Now, one of the reasons I'm making this video is actually Gia had jaundice during her first week, and we had absolutely no idea what it was. We didn't even know what to look for. So I figured it would be really important for a lot of parents to know exactly what this is and how to take care of it. That said, let's go straight into what jaundice is. Jaundice is basically yellow pigmentation of the skin and whites of the eyes. Now, it's the result of buildup in the blood of bilirubin, which is a yellow pigment that comes from the breakdown of older red blood cells. Now, this is common in newborns, so if you find out that your child has it or you think your child has it, don't freak out. It's actually called neonatal jaundice, and it's because the liver enzyme that metabolizes the bilirubin is still immature. Common in newborns, don't freak out. So, how do you spot it? You like those awesome graphics? Here we go. Well, obviously, the first thing you want to look at is the physical appearance of your child. Does your child look yellow? In a moment, you'll see a picture of Gia and what she looked like when she had jaundice, so you'll have something to sort of look at your child against. Of course, also, because it has to do with red blood cells, you can look at blood tests and sort of figure out if they have it or not. So, here's a picture of Gia. You can sort of see where she was yellowed out. Not a really uniform skin color going on. But if you really look at her face, you'll see all that yellowing. So now we can look at side effects. The biggest side effect, of course, is brain damage. I wasn't really able to find many side effects of it. We actually went with midwives, so they didn't tell us much about, other side effects. We just knew that it needed to be taken care of. But could cause brain damage in extreme cases. So, if your baby has it, you don't want to just sort of ignore it. You want to make sure it's getting taken care of. So, how do you take care of it? How do you treat jaundice? Well, you can do phototherapy, which is what we did with Gia. And it's pretty simple. All you have to do is get your baby in some sunlight, which had an added effect of putting her to sleep, which is pretty cool. But just make sure to cover your baby's eyes. We did 30 minutes per day, and about 3 or 4 days, she was fine. You can also look at artificial light, which is something that your doctor would probably do. But the same thing, same effect. Also, you want to make sure that your child is well hydrated, so get that baby plenty of fluids. In extreme cases, you can look at blood transfusion, but this is, extreme cases. Like I said, it only took 3 or 4 days of sunlight to get Gia right as far as, her tone and taking care of that jaundice. So you could see Gia with the jaundice. You could see sort of the differences in the skin tone, the yellowing. And this is maybe like 4 days later, after we had, put her in some sunlight and everything, you can see everything sort of evened out. So, now you know what jaundice is, you know the side effects, you know how to spot it, of course, the treatment for it. You see that it's easier, it's common, so don't freak out. Hopefully this video helped you guys out. If you liked it, please comment, like the video, and hopefully we'll be having some more videos as we learn things. We can help you learn things as well. Have a great one.